Good afternoon. My name is Louise Lynch, and I'm Integral Care's Network Authority Officer. Thank you so much for joining us today for the Community Forum Caregiver Support in Pandemic Times Tips, Tools, and Resources for those caring for persons with intellectual and developmental disabilities. Before we begin, we're going to start with an icebreaker. Our question is, which superpower would you like to have? Mind reading, invisibility, teleportation, flying, or I already have a superpower? Now, I'll give you a few minutes to answer that poll, and we're going to start with the panel. Let's start with you, Diane.
So I'm going to give you two answers. So fun one is Elastigirl from The Incredibles. I've always wanted Elastigirl arms, but my real answer is technology. I feel like Jane Jetson with video calling and my Echo Dot and my Roomba, and it is really empowering. It's really awesome.
All right. Malika.
Hi, I've always really loved X-Men, so teleportation is something that was always cool to watch, and I always wanted to do that as a little girl, so that would be it.
Okay, Barry.
I think mine was teleportation too. Star Trek, beam me up. I'm ready.
Okay, I have to say I already have a superpower. And so mine is that whenever I touch someone, it fills their heart with loving kindness. So now let's look at what you all said was your superpower. Okay, it looks like teleportation has it. Well, it looks like more than just a few people want to be beamed up, Barry. So now let's get started with our panel. That was a lot of fun. We are recording today's session and streaming it on Facebook. Integral Care is the designated local authority for mental health and intellectual and developmental disabilities for Travis County. For over 50 years, we have supported adults and children living with mental illness, substance use disorders, and intellectual and developmental disabilities. The last 12 months have proven to be a year like no other. The intellectual and developmental disabilities community, in particular, have been really hit hard. Family caregivers, professionals, and clinicians alike have navigated the new territory and adapted despite the immense challenges, including reduced access to services and supports. I'm honored to welcome our panelists who are here to share their experience and their tools that they're using to maintain health and well-being for themselves, their families, and their clients. Diane, will you wait? Diane Kearns is a parent, advocate, and volunteer. Her son has multiple disabilities. She is a commissioner on the Austin Mayor's Committee for People with Disabilities and previously served on the committee that advises the state on the establishment of Medicaid managed healthcare programs for children with special needs. She is also a product manager at a national telecommunication company in Austin. Malika Pritchard is a board certified behavioral analyst and has worked in human services for cities, school districts, the state of Texas, and university. Dr. Pritchard's experience includes work with adults with intellectual disabilities, children and adults diagnosed with autism who may have moderately to severely challenging behaviors. She also works with caregivers of children who are in Child Protective Services custody and with aging adults residing in nursing facilities. Boy, that's a lot. Barry Hamilton is the Vice President of Operations at Down Home Ranch, an intermediate care facility and home and community-based provider in Elgin, Texas. He is a manager and champion for direct support professionals. I love that, Barry, who coordinates and provides services, helping people with IDD integrate and engage in their communities. What an awesome panel. We'll start with the panel discussion, and then we'll move into questions from our audience for the last 10 or 15 minutes. We've incorporated some of those questions that we already received from you. Please type any questions into the Q&A box at the bottom of your screen. We'll get to as many questions as we can, and in case we run out of time, please include your email address so we can follow up with you. We'd appreciate that. Okay, now let's get to the panel discussion. Diane, you are a mother of a son with multiple disabilities. What's the pandemic been like for you? And what are some of the new resources you've discovered that you'll continue to use?
Hi, good afternoon, everyone. Pandemic has been very difficult for my son because he, number one, likes to be out in the community with friends, with family, and meeting new people. And because of his medical conditions, we've had to keep him at home. His favorite word is go. So keeping him engaged and stimulated at home, or, you know, in the community with lots of restrictions has been really challenging. Probably the biggest resource that we have used is our network of parents across the state. So my son is 18. I have met so many amazing moms and dads across the state. And we all have collectively been great at sharing any information, anything that we have learned through the pandemic. We use, we talked about superpowers. Technology is mine. So between texting, email, social media, getting information out to other parents and getting it from other parents to me is nearly instantaneous because of technology. And the example I want to give is the vaccine distribution. When I first heard out that people were getting vaccines from another mom who texted me at like 8 o'clock at night. And within minutes, I was, emailing, researching. By the next day, I had either got appointments or was on a waiting, or got my son's attendance on waiting lists since they were in the phase 1 category. And then when I realized I couldn't get my son a vaccine appointment, I started reaching out to my city council rep, our representative in the House, our state senator, and just using that technology to reach out to people, get information. Once I got it, I turned around and distributed it to my network so more people could get the vaccine. I think that was like the most invaluable resource, is that network of other parents and sharing info. The last resource, technology related, I gotta say, video conferencing, video calling. It's allowed my son to see his friends, to attend school, to see his family, to see his grandparents, and not feel so isolated. And fun fact, his 18th birthday party was a Zoom dance party, and it was challenging, but we got it done. And he had a lot of friends. His cousins in New York State were on, and he just absolutely loved it. It was amazing. So yeah, resources, definitely technology, and then also the parent network in the state.
Thank you, Diane. That's awesome. Dance party for the 18th birthday. Malika, how have professionals and clinicians like yourself, who traditionally provide in-person care and services, adapted?
Me personally, and speaking out to and reaching out to other clinicians that are all experiencing similar circumstances, we've shifted everything virtually. Sometimes we are on FaceTime, sometimes we're on Zoom, sometimes we're on a WebEx meeting, but all of the clinicians have shifted online. And so the face-to-face transition to virtual was challenging in the beginning, to say the least. There was a lot of challenges with people not having access to good enough internet speeds to do these virtual conferences. There were challenges with regard to having the equipment that they needed. So getting that rolled out was the biggest transition. And one of the biggest things, as I was speaking to other clinicians and reaching out to my network of folks that I lean on when I'm struggling or trying to figure things out, is that it's difficult to provide behavior services from behind a screen. We genuinely need that face-to-face connection, and we genuinely miss the clients that we serve, and we genuinely miss just doing things that are typically normal. Everything has shifted in a very strange way. So that being said, one of the cool things is that I've been able to provide more services because I'm not in my car driving around town seeing one person at a time. So I'm actually a little bit more efficient. So I'm excited because I think that I'm able to boost the amount of contact I have with clients right now.
Okay, now Barry, everyone has had to quickly pivot and adjust to the way we do our jobs. How have you changed your approach to clients, and what practices will you continue after the pandemic?
I think for me, I'm gonna steal this from somebody because I know it's been said 100 times, right, in the pandemic world, but not being like physically together, but still being able to be connected. I really thought that was important, and it's always important. But for me as a clinician, especially working in a residential program, like being able to see people all the time, every day, it was at one point, whenever it really became an issue a year ago, that it was just one day stopped seeing people, or having to see people from a distance, and it was out of fear, it was out of protection, it was all of the things that we can use to describe it. So I think that focusing on how to still be connected with people is something that professionally I'm going to focus on, and I did focus on. I'm going to continue forward. But also, the direct support professional, the DSP, the paid staff, who are supporting people either in their own home or in a different type of residential setting. Depending upon the type of housing arrangement, staff are really, they overlap a lot, and they really depend on one another to have good communication and to brainstorm and problem solve. And then also moms and dads are the same way, right? Like if you have this network of people, you need them to still be a part of it. So, encouraging staff, and also with myself, is just to make sure, even though you can't physically be with somebody, to still be connected with them. So one of the things that I did, which I'm sure all of us did, is we picked up all of these hobbies, right, that you had from a long time ago, and you brought them forward, or maybe you made some new ones. So for me, I can grow a mean pepper, and in some of my interests, I'm able to really share with people. We did it virtually, and now it's gonna, over the next couple months, we're gonna be able to take it in person, or next couple weeks, be able to take it in person. But some of the strategies that I learned from doing it online with connecting with people, I'm gonna still move forward.
Thank you, Barry. Malika, I want to ask you that same question. What kind of strategies do you think that you're gonna, or practices you're gonna continue after we get past this part of the pandemic?
So I would like to say wearing yoga pants every day, but I'm not sure if that's going to fly. I'm really, I'm really enjoying that part. I think what I'm going to do that I have been doing more often is reaching out and being more constant and being more connected. I think sometimes, well, I know for sure as a clinician who's running around feeling like they're putting out fires every day, that it is more fun to be connected and to connect in various different ways, just to make sure that a quick phone call, a quick check-in, a touch base with the staff. I've been able to do that more often in the pandemic times, and I'm going to continue doing that because those are the pleasurable moments more than putting out a fire or figuring out how to adjust when there's a crisis or an emergency. So
It
yes,
almost sounds like both of you are talking about being more intentional about your engagement with others.
Yeah, absolutely.
absolutely right.
And, your superpower, Luis, of touching someone and I'm going to call it the warm and fuzzies. I think I'm going to use that. I don't really know how many warm and fuzzies I'll be able to give people, but if anything, I can trick myself to think that I can. And yoga
Yeah,
pants would be a good thing to wear.
that's great. Diane, we've all had to change our routines in the way that we do things. What is working well for you, your family, and your son?
So consistency is really important for my son, but it also can be very boring, especially when you can't really leave the house. So we found things that he likes to do with different people. Different attendants like to do. Maybe one likes to cook with him. Another likes to watch football or basketball on TV with him. Another may want to, likes to take him outside and take walks around the neighborhood. So we try and think outside the box. Are there things that we can do? Like my son loves to go out into the community. So part of that is getting we have a wheelchair accessible van. He can't leave the van. So we bought an unlimited car wash package. So we have the cleanest van on the block because he goes probably 4 times a week and gets the van washed. If there's anything that needs to go to grandma's house, he is the errand dude, and he, can yell at grandma from 15 feet, at the curb with the van windows rolled down. So he gets to see his grandmother. He gets to kind of go out in the community. So we've had to think outside the box with respect to that. He's totally addicted to ocean water from Sonic, which is the grossest drink, but he loves it and he looks forward to it every afternoon. So that's, some of the things that we've had to do to, kind of shake up our schedule, be consistent, but also, do different things.
And Diane, just a follow up, you're needing to pour so much of your energy into your family. I'm wondering, how are you taking care of yourself?
So I'm probably like a lot of moms who, gets embarrassed when my house is dirty. I've just learned those kind of things. I just let them go. I mean, no one's coming over. No one can see that there's dog hair all over the floor. And it's just kind of freed me to do fun things with my family. I mean, there have been weekends where like we have barely left the couch because we've been binge watching Netflix. And that is okay. So allowing myself to kind of let things go and allow myself forgiveness for those kinds of things. Of course, that's going to change soon because most of us have been vaccinated. So, chop, chop, back on the vacuuming. The other thing is I love cooking, and I've just been cooking a lot and experimenting a lot. And you talked about things, not habits, things that hobbies. Sorry, that's the H word. So I love cooking as my hobby. I have totally given up on sourdough bread because just no one can make it. I'm sorry. But I also have perfected my biscuit recipe. And so, I think my family's waistline has expanded because of all this cooking. But it's a release, and it's something that I get to do with my family and my family can enjoy. And, kind of looking on the bright side of all of us being together, what can we do together? What are new things that we can do?
This may turn into a recipe exchange.
Don't look at me, I don't cook.
Oh, Monica's gonna find something online and just share it with us.
Oh boy. So, Malika, how have you gotten creative? Speaking of creativity that Diane was talking about, and not in cooking, gotten creative during this pandemic to adjust the way you support clients and their caregivers and help them stay consistent with behavior programs.
I went back to learning. I went back to every learning opportunity I could find, every webinar, every opportunity to expand my knowledge base as far as research is concerned. As a scientist, I'm constantly feeling like I'm behind on the research, and this year I'm not behind. I'm ahead of the game in a lot of regards. I've read a lot. I've read a lot of books, and so I'm not very creative. I don't really do art or cooking or anything like that, but I definitely will read. I'm very much am going to expand and sharpen my mind and have fun doing it. Yeah. Other than that, I've started roller skating again, and I haven't fallen. So I think I'm going to continue that too.
All right. Diane, what's worked well for your family in terms of, um, consistency and during this time, daily life?
So before the pandemic, everyone was kind of off doing their own thing. And since we're all together, schedule is important. I think sitting down together at mealtime, eating that delicious home cooked meal that I just made. And, it doesn't always happen, but when we all get together, we're at the table, we're talking, we're laughing, we're telling jokes, we're sharing our day. It's just, when we can do it, it's definitely the highlight of the day. And also, I think the key is, as part of that, is listening, to what my son has to express. If there's anything that he wants or any changes that he needs, whatever, just listening to what he says, and which can be challenging for a child who's nonverbal. But trying to figure out, what he's trying to communicate, have that discussion, make sure that he's getting to express his voice and make his choices, I think has been really key at kind of maintaining that consistency and schedule and sanity, I think, for everyone.
That's great. I really appreciate what you said about really listening, particularly during this time. So Barry, what about you? What have you found to be, exploring your creative side during this pandemic?
I think that, well, many years ago, I was actually working in a day program, and one of the people I was working with knew how to do stained glass, and so they showed me, and I made one piece, and it's kind of one of those things where you get it, you make it, and kind of put it on the shelf. So I've revived that. So I've been spending some time plotting and looking and thinking about what I wanted to do next, but then also in the program that I work in, we really encourage everybody that's in our organization to be part of that type of programming. And really it's connecting with people. So being able to share my interests with others who may be interested, or maybe people who they've seen it, they may know what it's about, but have never had the opportunity even to take part in it. So I'm very excited that in a couple weeks, I'm going to be working with 3 or 4 folks. One of them actually has worked with stained glass, other 2 never have. So I think, like, for me, is really looking at what I'm interested in and bringing it professionally to the table and using it in a way that's really meaningful for the people that I support, but also for me, right? A little self-care. And if I'm passionate about it, other people are going to be. But I think also, something to think about with like being consistent and I've seen there's been a huge shift in like how I'm going to talk about residential providers, right, and paid
Mhm.
staff. So there's been a huge shift whenever the pandemic happened. We went 360 degrees the other direction. So it was, how do we support people to have really full lives? And, if it's meaningful, like how do we like get them closer to that? And how do we get them more experiences they may be interested in? How do we support them develop these hobbies? And then just one day it stopped, you know? So, the creativity of the support system, the DSPs and the parents who are in the homes trying to figure out like what to do, cooking, I'm all on board with that. I may come over. I want that. I want that recipe for the biscuits. But, to think about like the use of technology, I agree. Like Teams and Zoom, it has been amazing. And some of our community providers, like the rec center, close by, they make all these really great like goodie bags. So we were grabbing those and doing like, different types of like things in community where you would go to different sculptures in town and, learn about history of the different buildings. But also, connecting with people in a more meaningful way, even though they were in separate houses, they were still able to do some online stuff. And maybe they were outside, yelling across the road at one another to still build that connection. So I think whenever there's a challenge, there's always a little spur of ingenuity. And if you can bring a piece of yourself and what you're interested into the fold, it's really beneficial, not only to yourself, but to others.
So just to say more about that, since you started talking about meaningful connections and relationships, um, how do you see this as a moment of really making those relationships thrive? And during this unique time, how we can stay connected and find moments of happiness?
Yeah. Um, I've always really been a fan of a good handwritten note. And it could be a letter. I'm not really a letter writer, but I do like writing notes where it's a sentence or two. And usually when you get that in the mail, there's a whole excitement about it. So I've been writing lots of gratitude letters. And I think that that's a way that it helps me stay focused, and it helps me to find a moment of calm and peace, while also kind of sharing the happiness with other people. And whenever I'm writing those things, I'm also thinking back over like my grandparents, like whenever you would see those letters that they would write and the postcards that they have, or my parents who still have love letters. So it kind of conjures up not only like it's nostalgia, but it also like it kind of puts me in that moment of being able to connect with people. So really, I think it's and those are things that I'm not going to lose. I'm going to continue to do that. I have my calendar and I mapped out all of the birthdays for my extended family. And I have one distant cousin, second or third cousin, that she sends birthday cards every single birthday. And I want to be like her. And I'm going to help others to be like her too.
So, Diane, let's talk to go to you about what about your family? How are you creating those moments of happiness and thriving? Besides the biscuits, of course, we know that's all good,
So
but
good too.
other ways in which you're making that happen for your family.
So one of the things that we did, I think we started it at Thanksgiving, is we have a large extended family that's across the country. And one of my cousins said, "Hey, what if we did a Thanksgiving Zoom?" Um, and so I was like, cool. My son's got a Zoom account. So I set it up and we set it for 2 hours. And we had people across the country, cousins that I see maybe once every, 3 or 4 years, aunts and uncles that I haven't seen in a while. Everybody jumped on and everyone, we got to see new babies, we got to chat. And my son Dean was like, he was there throughout the entire thing and he was so enthralled and it was so great seeing people that he hadn't seen. And then my other side of family did the same thing for Christmas. And so now we're trying to figure out, what are we going to do for Easter? I just realized I had been so busy, nobody set that up. So I think that's something that we will continue to do, is do that celebration of family on, big events, big holidays, and use the technology of video conferencing. So that is definitely something we will not give up.
Thank you, Diane. Barry, I want to go back to something about you being a champion for direct support professionals. And want to ask you a question similar to the one that we've answered here about happiness and thriving. We know that individuals who work most closely with individuals with intellectual and developmental disabilities need a lot of support too, parents and our staff. How are you supporting your staff during this time?
I think that now this is not something that I think that's a very good question. I have so many thoughts. Here's the first one. I think first off is what we did as an organization is we looked at what kind of risk paid support is. I mean, it's risky. You're working very close with people, then you're going back home, and there's potential there, right? The pandemic, scary, very scary, especially whenever it first started. So looking at hazard pay and ensuring people are, if they're in a situation where they're putting themselves at risk, that they're getting compensated at least a small amount. Also, what we did, we're a pretty small provider, but during the time up until vaccinations were readily available, if you did not have PTO, we supported people to say, if you need to take care of your loved one or someone else, we developed a PTO pool. So what it did is it took away the I may not have a check if something happens. And that was something that was really important to the organization and to me and to everybody, right? Like that's not something you need to worry about. So I think that was really the first part of it. And then also what we did is, I'm sure many of you have heard the town hall. How many have heard town hall? I mean, there's been town halls for everything. So we took that idea and we were doing town halls every other week. And it was a way to disseminate information. We looked at numbers locally and, so everyone could make the best informed decision. So, in the service delivery system for people with intellectual and developmental disabilities, this isn't lost on anybody, right? It's about like informed decision making and informed choice. And so we took that and then applied it to the organization in a real meaningful way where everyone can have this information, they can have ready access to it. And also if something came up, they wouldn't be worried about paying bills. That was something that was really key. And then also, really looking at, the frontline managers and supervisors, we're talking like residential setting. It's a really hard job, and because we had to do this complete, flip from what the trajectory was because of the pandemic, it really took a concerted effort to have more consistent contact, more phone calls, more, laying eyes on people virtually just to say, hi, how are you doing? And then I'd say the last thing that I'll share that we did that we really focused on was, remember whenever you couldn't get toilet paper? Yeah. Feels like it was a million years ago, but luckily, we have some way, we're a commercial business, so we have, ways to get it didn't really affect the commercial delivery system the way it did. So being able to pass that along to staff too, to say, hey, you don't have to go stand in a line for 2 hours to get toilet paper. You can get it here and we can help you with it. It took a lot of, I think, the burden, or maybe it just made like a relief. So yeah, thanks for asking that. I appreciate it.
All right. Thank you. did anybody want to weigh in on that in terms of, supporting other people? I know Diane, you had some caregivers in and it wouldn't surprise me at all that they shared some of the stress they were experiencing.
Yeah, I mean, Dean, we've had Dean has had some of the same caregivers for. I mean, he's 18. He's had some of them for over 5 years. He loves them. They're like a part of our family, and we've asked a lot. We had one caregiver. You know, she had to skip spending Thanksgiving with her family because she was afraid that she could potentially, come back and give Dean something. We've we've asked them to quarantine after they've gone to see family, and they've done it. At the same time, we've done exactly what Barry was saying. I was really concerned about everyone's financial situation, and knowing if somebody missed a week's worth of work, what were we going to do? How could we juggle to make sure that people got the same paycheck so they could make their rent and pay their bills? So we did that, and then we constantly tell them we appreciate you, thank you so much for everything that you do. And we make a big deal out of birthdays. We do a lot of baking. We do a lot of eating. So what's your special dinner that you want for your birthday? I mean, we do stuff like that. Anything that we can do within our financial budget, we do that to make sure that the personal attendants are appreciated, and that we value them, and that we love them.
Thank you. It sounds like you guys are doing some of that magic touch too, in terms of how you've been taking care of people during this time, and that's really wonderful to hear. Okay, so we have about 20 minutes to get into the our question and answer period. So we would love to hear from you all that are in our audience today. If you could put your questions in the Q&A box. We do have some questions that we had received previously. So I'd like to hear from all of you on the panel. If you had one piece of advice to give to caregivers that could help them right now, what would it be? And let's start with you, Malika.
Yeah. My piece of advice that I am giving to everybody, and I'm giving it freely and openly anytime I can, and I'll say it multiple times, is that we're still in a pandemic, and with regard to challenging behaviors and the type of work that I do in the community with regard to providing behavior support, we are not in a position right now to place too many demands on caregivers that are already exhausted and persons that we're serving that are already exhausted. This is not the time for pressuring people to learn new things and to work really hard and to meet all of these objectives and goals right now. We are in the business of prevention. We're in the business of creating peaceful days, and a peaceful day is a win. And even like Diane was saying, even if it means we sat on the couch and watched Netflix all day, that's a win. We should be in the position of preventing challenging behaviors from occurring by setting up the environment so that it's peaceful and happy, because those days are few and far between some weeks. And I'm not in the business right now of taking things away from people that they really like and doing all of those things, which is a knee-jerk reaction when people are stressed. So I'm constantly saying, I know you're stressed, create peaceful days, whatever those days look like, and each person's peaceful day is different. And that's important right now because we're just trying to survive.
Thank you. Diane, do you want to weigh in on this question?
Can you repeat the question again? Sorry.
Okay, yes, it was a long question. So what's one piece of advice you would give to caregivers that could help them right now? What would that be?
One piece of advice. When we look back, 10 years, 5, 10 years, 20 years from now, what are the things that we're going to remember? Are we going to remember that we sat on the couch and binge watched? There's a show on Netflix that I thank God I had the fast forward. I'm like, a mother and son should not be watching this together. We're totally going to remember that. We're not going to remember, and the biscuits. So many other things. It's just going to melt away. We're going to forget that. Think of the things that bring everyone joy. Focus on those.
Mm-hmm. Very.
I mean, it totally aligns with what's already been said, but I'll just say it briefly. I think whenever someone has a challenge, how do we figure out how to make their world bigger, not smaller? Get them more things of the things they like.
Okay. Diane, I have another question for you. So, and this is one that came in from the audience. How do you show your son respect during this time of increased isolation, social distancing, and less access to safe hands-on activities?
It's tough. I have, my son has a twin sister. They're 18, they're adults. They have the right to do what they want, right? But it's my job as a mom to make sure that their choices are safe. So there's a lot of listening. There's a lot of collaborating, a lot of discussing, a lot of explaining why. So much explaining why, and then kind of coming to a consensus. So when you have a child who has intellectual disabilities, there's a lot of why, there's a lot of when, there's a lot of trying to make sure that they understand what's going on. And I would say, 90% of the time, I think we get to that positive, collaborative, everybody's happy, kind of win-win. And then there's other times where I have to kind of put my foot down and say, no, you can't. I'm sorry, we can't do that. It's not safe. So a lot of listening, a lot of collaborating.
Thank you, Diane. Barry, I have a question for you. How do you advocate, especially during this time, for your clients and their parents in your practice?
I find advocacy very interesting, and I like to frame it from advocating with. There are some things that I can advocate for, but usually it's policy stuff, which is important but slightly boring sometimes. I think what it is, it goes back. I'm gonna echo. It's listening, and some people communicate through their behavior. Well, we all do. Some people a little more than others. So listening there, and then really supporting the person, the family member, the paid support, the DSP, the staff, to maybe change the script ever so slightly, and kind of the low-hanging fruit on that is whenever someone says, something along the lines of attention seeking, and I know that it's a meaningful definition, right? But typically what I do is I say attention needing. And just by changing that script ever so slightly, it puts it in a different frame. And I think that's something that's been very helpful for me. And yeah, great question. Thank you.
Thanks, Barry. Diane, here's another question from our audience. Can you describe for us, or give us an example for those caregivers that might be struggling about that work-life caregiving balance? How are you making that work?
Balance. I think like every mother in the country is trying to get that balance, especially when I have 3 children, so they're at home for school. I work from home. And then, all of the other, things that we're trying to continue moving forward. It's, there is, I always like that phrase, it takes a village. So my family has a really great village that we've got. My son has personal attendants that will, when I, I need to focus on something for work, or I need to, um, you know, do something around the house. I need to, whatever it is. My son has caregivers that will, help him to do whatever he needs to do, whatever he wants to do. So um, I can focus on other things, whether it be taking care of, my father-in-law or my parents, or, whatever it might be. So kind of relying on the village. I totally lost my train of thought now. And I'm not sure where I was going with this, but I think just relying on people, relying on a schedule. Google Calendar is super awesome because it's on there, and I'm always like, I have no idea what time that appointment is. Look at the Google Calendar. So
That's great. Malika, I know that not everyone in in our community has that village that Diane talks about. And I'm wondering for those families or children's or even adults that are in those nursing home environments that are kind of struggling with the isolation or those things that come with this pandemic, how have you been able to help them through this?
That is very difficult. I'm not sure if I have been able to help with the isolation very much at all. I'm part of the isolation. I'm isolated also. I do live my life being very honest and truthful. So I've been very honest and truthful about my own losses. We've had births and deaths in the last year in my family. We've had very, very exciting 70th birthday parties for my father-in-law that were coordinated virtually across the entire country. I have international connections and friends and family. So I don't know if I have too much of an answer, except for the fact that I think it's okay for clinicians and professionals to tell everyone they interact with that I'm struggling too. I have no idea what to do either. This is what I've figured out, and this is what I'm hoping for. And I think that honesty and humility between people is maybe more of a gift than people anticipate. I don't always have to look like I have it together all the time, because some days I just don't, and that's okay too. And then the only other side part of that is once the pandemic hit, I started to search for new communities. So I've had new communities of friends, people I haven't even met face to face yet, that I've been speaking to consistently over the last year. So I have new friends, and I think that helps with my isolation. And in particular, I think that the amount of emphasis or the lack of connecting people to spiritual groups and spiritual well-being, I think that has been something that I've started to incorporate in my life. And your local church, mosque, synagogue, temple, those are communities resources that are routinely under-tapped and routinely left out of the conversation when we talk about your biopsychosocial health. Spirituality should always be part of that conversation if that's what the person feels comforted by.
Oh, thank you for that, for especially bringing up the other aspect that we often don't talk about, which is our spiritual health.
Mhm.
Diane, uh, wanted to talk with you again about some specific resources that you've also found or that you could recommend. I know you talked about your recent connections, particularly around the parent group. Are there other resources that you might identify for families that would be helpful?
yeah, and I think, I think people tend to forget that we have elected officials that are there for us. They are part of our village. Example, when I was trying to find a vaccine for my son, and my son was not part of even the phase 1B group, even though he had disabilities, he had medical conditions. Um, so I reached out to our city council rep, and there was a wonderful woman who was like, you know what? I had the same exact problem with my mother, and I'm going to give you some like advice of what I did. I wrote that all down. And then she's like, I'm also going to call Austin Public Health for you and see if I can find anything out. And that was amazing. It started this snowball of like, here's this person to contact, this person to contact, which I in turn turn that over to my parent network. And then, the whole policy of why weren't, why is my son not listed in that group? And I know there was some other advocacy work to get people with a diagnosis of Down syndrome on, I think it was phase 1B. So, yay to everybody that participated in that advocacy, but there are people in our government that we have elected them. They are there to help us, and we need to engage. So definitely elected officials, part of our village.
This is a question for each one of you that came from the audience. An audience member was saying how their relationship with their neighbors had changed during this pandemic. I'm wondering, both in terms of your, professionally, I mean, Malika, you talked about engaging in new networks, but our neighbors, how have our neighbors been? Have our neighbors become closer, further away? What's been the experience during this time? Malika, we can start with you.
Yeah, much closer. I'm talking to them more often. I'm texting them more often. I'm asking them to take care of my dogs, keep an eye on the packages on the front doorstep, because people are sending gifts more often these days, which is really nice. So every day it feels like I got a new gift or a care package, and just simple things like, peeping over the fence and saying, "What are you cooking over there?" has been so much fun. And it especially came to light once we had that horrible bout of weather. The amount of people that were contacting, connecting, especially we have a Facebook group with our neighborhood, and just the resources and the what do you need. It was wonderful to see. It was really, really nice. And I'm so proud of living in the Austin community for so many reasons, but once that weather hit, I was on another level.
Thank you. Barry, how about you, in terms of, down home ranch and even in your own life? Have you noticed your neighbors have responded differently, or any change in that?
Absolutely. Yeah. So I'd say, thinking about the elected official, I'm sure many of you who are on this webinar experience a couple days, if not weeks, without power or gas. And that was where I went. The advocacy that I said was slightly boring. It's really not. It's just not as fun as being with people. But calling up and telling them about what the experience has been like. But that was something that I found a lot of value in. So really, and also maybe even engaging them in a little bit different way, not only when I have a complaint, but yeah. And I would say, like in a residential setting, you really, group homes in general, or more congregate settings, they may not know their neighbors. I think that, with the programming that we have, we've very well connected with community. But one of the things that I saw happening is that neighbors were calling and saying, what can we do? How can we help? And that started a connection that, even in the most positive times, and like being able to go in downtown and, shake a leg, at the Hog-Eye Festival in Elgin, then whenever something really major happens, being able to call and say, "Hey, do you guys have waters or something I can help with?" Maybe driving jugs of water from one place to the next. Yeah, so I've definitely seen it. Looking at this comment, absolutely, neighbor relationships have skyrocketed. Whenever I actually see people, they're not, I'm like, oh, I actually know a little bit about them now.
Yes. Diane, how about your neighbors?
Sorry, the dog we adopted during pandemic is barking. I don't know if you can hear him. Anyway, so yeah, the weather event, and we had met our neighbors. It's a relatively new house for us, but when we were able to leave to get to the grocery store, we basically went around and said, "Hey, do you guys need anything?" Because we're venturing out And we got to the store and my husband and I were like, okay, you go that way, I go that way. We had our lists. We're, we're trying to explain why we're getting 4 dozen eggs, even though it's above the limit because we're shopping for neighbors. And so, yeah, I mean, it was, something that we could do for them. And it was great knowing that, we could help other people. We are so much on the receiving end of people helping us. Us being able to help other people was really great.
Oh, that's a beautiful story. Malika, here's a question from the audience. They're they're talking about their BCBAs or BCBAs, really itching to get back in more face-to-face direct services and feeling that families are tired of virtual training. Uh, Oops, there went that question. Um, Lady, will you help me with that question, please? It kind of went off. Oh, here it is.
Yeah.
Lady, would you go ahead?
Yes, let's see. I think
Uh,
going to,
they're okay, here it is. They are grieving about treatment gains that in some cases they see slipping away. What would you tell them if you were speaking to them directly about this?
Yeah, and I wrote to Carrie and said, I've been really honest with my students. I've been working as a college professor during the pandemic, which is really challenging, and my students are working in home settings and clinic settings, and they are trying to become behavior analysts in very confusing times right now. And they are sad. They get sad because they see lots of skill gain. They see lots of wonderful progress kind of slipping away. They're seeing some regression in skills, and that's to be expected when conditions like these environmental conditions change. That's to be expected. I think we're going to, well, I'm going to say pretty strongly, I know that the public schools and private schools and all of the schooling is, the teachers are feeling the same way also. The teachers are feeling, did we lose an entire academic year? What are we going to do? Some parents have elected not even to send their children to kindergarten this year. They're going to hold them back. So this is a shift in learning. But I will say, since I'm speaking to behavior analysts, that we should be in a situation where we have a wonderful science of behavior that will help us kind of get those skills back. It just may take a little bit of time, and it's okay to grieve those losses because everyone is experiencing the same conditions. So I think the undertone of that conversation is clinicians can feel guilty sometimes. Clinicians can feel like they are failing people when they have no control over any of these circumstances. That clinician guilt is a thing. So that's, the forgiveness needs to be part of the conversation when we're talking about professionals also.
Well, thank you so much. I mean, what an exciting panel this has been, and I so appreciate um, everything that you all have said and shared with us today from your heart. Um, so we want to thank you for your insight and for your time, and want to thank everyone who has joined us today. It's important and hopefully healing to talk about the challenges that we faced during this year, and even more important to share our tips, tools, and resources. Remember, it's important for you to take care of yourself during this stressful time and reach out for help when you need it. We have a number of wonderful resources for caregivers. Many are responses to questions that came in from audience members before the forum. You can find them at integralcare.org IDD resources. I'll repeat that again, integralcare.org at IDT resources. You'll also receive an email with a link to the resource page. When the forum ends, you'll be prompted to take a short survey. We hope that you'll take a few minutes to share your opinions with us. And thank you again for joining us, and be well and safe. And to the panelists again, thank you so much. And if you have one last word to share with the audience, What would that be? Malika, one word.
Joy.
Barry?
Care for yourself. Ooh, more than one word.
Diane?
Start cooking.
All right. So with that, thank you all so much. We appreciate your time this afternoon. Bye-bye now.
Thank you.